Okay, an interesting newscast the other day talking about a new potential policy being adopted in the UK. Take a listen to this.
We all know it's become an epidemic in the Western world, and it doesn't seem to be getting better anytime soon.
Listen to these numbers. More than 1 in 4 adults in the UK are obese. Now, one organization there says children should measure their own waistlines, putting a measuring tape around their midsection to prevent them from also gaining too much weight. Xavier Walton joins us live. This is a move that Japan is already doing in real life. So tell us more.
Well, Japan is doing it, and soon enough, the UK could, keyword, could follow Japan's lead. And the obesity concern, really, especially when it comes to children, extremely high in the UK. And that's why some of these health officials are leaning towards going this direction when it comes to following Japan's lead and addressing this growing problem, right? In Japan, there's a controversial law that says all employees between the ages of 47 and 74 must have their waistlines measured by their employer annually and receive guidance if they do not lose weight after 3 months. It's called Metabo Law, named after a condition called metabolic syndrome. All right, so the law is supposed to be preventative, helping people avoid more serious conditions down the road, like heart disease or diabetes, for example. Well, according to the UK's House of Commons Library, 10% of British children between ages 4 and 5 were considered obese in 2020.
Okay, so as they announced that, perhaps, this hasn't, been passed yet, but potentially, like they do in Japan, where they have basically no real issues with obesity. Japan has, basically said if you're obese, it ain't happening. We're not going to cultivate it. We're not going to accommodate that. We are going to make it very challenging for you to be obese in this society. In the UK, starting, realizing that they're having this growing a childhood obesity issue like we have in the U.S. It's even worse, by the way. And whether this could happen in the United States, who knows, right? But interesting. I'm just kind of interested into thinking about the the implications of this. You take a kid out, 6-year-old kid, you measure his waist and says, "Hey, kid, you're too damn fat. We need to do something. We need to address this at the beginning." Now, the question is, one, is that a problem? Would that sort of traumatize a child in a way? Would it stigmatize a child? Of course, there's people that would say, of course, that's horrible. You shouldn't call out kids. You shouldn't measure them. Although we're being measured in all kinds of ways. And remember, in school, they measure you how smart, grades, performance, and whether you're called on to read things. I mean, there's constant measuring and comparisons that are occurring. So this would be just another one of those. And some people say, well, it's an invasion of privacy. We're not out there like measuring other aspects of their physicality, what their foot size or something like that. That's one concern. And then the other concern would be, well, what are you going to do about it? You got this overweight kid, right? I mean, clearly something should be done. I would agree with that. Whether it's, identified by, you can probably look at people and say, hey, look, you probably got too much weight there. You probably don't need to measure the waist, but, just say you decide to use that metric. What do you do about it? Do you put them on a weight loss drug, right? Do you mandate some sort of exercise program? Do you restrict their calories? I mean, what are you going to do about this? And I think this is a real crux of the issue. And I think this is, again, what is setting up this problem in the first place? Why do we have a alarming rate of obese children, 20-some% in the United States, versus what we had 50 years ago, where it's 2% or something like that? Why are we seeing this? And again, I think it goes to, what are the policies are you willing to enact? Are you willing to make systemic policies that, either educate the people on the dangers of these types of food? And I hear these, really the thing that really drives me crazy when you hear these dietitians saying, there's no such thing as a bad food. All foods are good, and it's all context-based. When I think clearly there are foods that no human has any business consuming, right? I fully believe that some of this absolute industrialized petroleum waste product, garbage, blue, neon green food is not something that we have really any need to eat or business to eat, and we should not moderate that. We should completely shun that, and we should not allow our children to consume that in any amount, right? I believe that. I believe that to be true. Now, certainly people will disagree with me and will tell me that, you can eat your industrial sludge in moderation and be just fine. However, again, that's a different opinion, I suppose. All right, guys, busy times. I'm going on the Dr. Drew podcast today. I've got a documentary team coming out tomorrow. I've got all kinds of research meetings, setting up stuff, trying to get some of this carnivore diet data done and science done. So some good times. Thank you guys for supporting me and what I've done so far. Thanks for supporting each other. This community is a very important community, both to me and to the world, I think. I think we're learning a lot. We are the tip of the spear, so to speak, in some of the changes that may be coming along. And it doesn't happen in isolation. It's not, I can't do it by myself. And it really takes the willpower of millions and millions of people coming together to make this change. And I am confident we have the ability to do it. Now, do we have the desire to do it? That's something that I hope to sort of convince people that it's worth it. All right, guys, hope you're having a great year. Hope World Carnivore Month, day number 4 is going well for you guys. I got a ribeye steak I'm going to go eat here in just a few minutes, and put a smile on my face and a nice feeling in my tummy. All right, guys, we'll talk to you soon.